Hello, everyone. I'm just going to give it a couple minutes for people to log in, and then we'll get started.
Hello, welcome to today's panel, Building a Holistic Labour Strategy, Recruitment, Development and Retention. We have a great group of people today on the panel, so we're going to kick off with a round of introductions. I'm your moderator for today, Sinead Borgerson. I'm Associate Director at Duke University Health Systems, and it is my pleasure to introduce this wonderful group of people who are going to talk today about how to build that holistic labour strategy for your team. And the everyday wins and stresses and occasions for getting better that we all run into. So Lisa, pass it to you and welcome.
Thanks, Sinead, for that great introduction. My name is Dr. Lisa Lockheed. I have the pleasure of being the Chief Nursing Officer and Vice President of Quality for St. Lawrence Health System in upstate New York.
Fantastic and welcome. Thank you so much. Joe, please introduce yourself and welcome.
Thank you, Sinead. My name is Joe Wilkins. I'm the president at St. Francis Medical Center, which is in Richmond, Virginia, a Bon Secours facility. It's so great to be on this board this evening to discuss workforce and how we can bring people into healthcare.
Oh, fantastic. Thank you so much. Aaron, least but not last, please introduce yourself and welcome.
Hi, thanks for having me. Aaron Haychart. I'm the Chief Operating Officer at RWJ Barnabas Health Community Medical Center. We're a 592-bed teaching hospital located in Toms River, New Jersey, right on the Jersey Shore. Been here for a couple of months. Very excited to join the conversation.
Well, fantastic. Well, thank you so much. We have a lot of years. I'm probably guessing I have over 25 years in HR, and I'm sure everybody else here when in the groups that they're in, we're probably well over a century of experience here in the room. But we've seen things change, and we've seen how things quickly change over the last number of years. They're diving straight in to, my comment on HR is get them, grow them, keep them. But the getting them and fighting for the same talent, obviously, is one of the biggest things that every group, it doesn't matter where you're from, is really struggling with, especially when we're competing against places that have massages seemingly nonstop for their staff and all of that fun. So what innovative approaches have you implemented to optimize talent sourcing and recruiting and candidate outreach in your group, especially in the competitive landscape we're going for clinical and non-clinical staff today? Anybody want to pop in first? Yeah.
It's been a real challenge post-COVID, filling the nursing vacancies and turning over nurses quick enough so we can reduce our travelers. I think everybody in healthcare has really been suffering the financial burden of paying for very high, expensive travelers who really aren't loyal or committed to all of our quality outcomes that we want for our patients. So we took a different approach because of how rural we were. It's even hard to get travelers at certain times of the year, especially when you have negative 29-degree weather through January and February. So I actually partnered with our one of our affiliates, and we started our own LPN school. And we have since graduated 3 classes of LPNs. Very exciting because within 10 months, we have a resource pool that can quickly help to reduce some of our travelers.
Fantastic. Yeah, I think everybody's coming out a different way. I think every group is also one of our goals, 2024, reduce that traveler budget, right, for contractors. Joe or Aaron, what about yourselves? What have you brought into your teams to try and basically go get that talent that we need today and tomorrow?
Yeah, I'll jump in there. So one thing we've done is definitely going out and meeting our potential employees and associates where they are. So
Mhm.
going out, of course, to the different schools, it's so important to put our faces in front of them. So we've done a lot of that. However, from a standpoint of recruiting as well, we are using AI from an HR standpoint, and this has been very beneficial in terms of using AI to really scour all the different applications and those who are looking to go into healthcare. And so the technology allows us to really widen our net of our applicant pool and then be able to really reach out to them directly to let them know what we have available. So again, this is on the internet, on the different web engines, making sure that we're able to reach out to them because they have somewhere in their profile indicated they are looking to go into healthcare, and the AI technology picks up on that and it reaches out to them to widen that net of our applicant pool. And year over year, we've seen a significant improvement and increase in the number of applicants as well as the number of hits that we're having based on that technology.
That's wonderful. That's great. I know that I think everybody sees the potential with AI and how it can help in a lot of the administrative tasks. I know myself, I use it to, instead of half an hour trying to craft the perfect email, letting it, Copilot craft for me and then taking it down myself. So fantastic. Aaron, do you have anything to weigh in on this from your team?
Yeah, I would echo what Joe and Lisa have been doing. We're kind of doing some of the same stuff. We've really looked at optimizing our application portal. Definitely, had some opportunity there, and I think we made some strides, to make it easier for people to apply. We've really focused, similar to what Lisa was talking about, of creating, more unique pipelines into the organization. We have, for instance, we're pursuing development of our own EEG tech program and sleep medicine tech programs where we're going to train people from within the organization as kind of a career ladder. And we have those, the RN career ladders that you see probably everywhere now, but we've expanded that to, med techs or PCTs or whatever you call them. We call them PCTs, but the floor medical support staff to help them kind of advance their career, give them something to work toward, but also create, a pipeline into other careers within the organization. And that's, I think, really shown some benefits pretty early on. And so we're taking that ladder and, it's not going to be just nurses and med techs, but we're looking, could we do that in EVS and food service and some of the other disciplines, where I think we're challenged with. And to the earlier point, really doubling down with our academic partners in the organization, in the region, and really focusing on those partnerships where we know, the juice to squeeze ratio is pretty good. We're academically affiliated with Rutgers University and their health science programs. And so leveraging that relationship and, kind of really focusing on them versus having random stragglers, that, may have a random, PT or OT or nurse that may rotate. But really working with Rutgers locally, we have another community college as well as another four-year school that we're also very closely partnered with nursing education as well. So really tightening up those relationships so that it bears fruit and that we activate that and focus on that to retain those students into employment.
Oh, perfect. Yes, I know a little bit spoiled at Duke because we have the School of Nursing right there. So we do have a thing, but still, like everybody else, struggling with the get them, grow 'em, but the keeping, right? The retention, that everybody's competing for the same talent. There's at least 5 wonderful health systems that's stone's throw within our area as well. One thing that we've done is really focused on securing LPNs and bringing them back in, which was something that the health system had walked away from a number of years ago. But like that was COVID, everybody's like to get the talent in, and virtual sitters. So using virtual nurses, virtual RN with the AI, but using programs and we're test piloting right now to give the nurses back time. So instead of taking that time for discharge, in walking through is to be able to give the nurses back time face to face with the patients. The other program that we brought in was internal traveler program. So people who were really wanting particularly to float, but wanted another incentive to do it. It's still cheaper than an external traveler program, but it's helped us to really also cross-train some groups and have folks who that career mobility. As I always say to my staff, it's no longer a ladder only, it's a climbing wall for careers. And, and a lot of people need to go over and get talent somewhere else to then get skills to be able to transfer. And while healthcare traditionally has been that clinical ladders for each, just witnessed by the panel here alone, the journeys that you've all come from your different places starting to where you are now, I think is very indicative of what we're going to see across the next 5 years. So it's great. Thank you very much. How's your labor strategy evolving to the expectations of the healthcare workforce, particularly in terms of their flexibility, career mobility, technology use? We went hybrid or remote, fully remote during COVID as we had to. Obviously, most healthcare systems couldn't do that 100%. You need to be there with the patient, but we did see it. And how has that changed the environments that you're working now? As I said to my staff about a month after when this happened, I said, we're never getting that genie back in the bottle, right? Now that we have it, and myself included, we try and work a hybrid schedule and brought in flexibility for the staff. But I'd love to hear, from you, how you're seeing it in your departments and if you're using any software to help you with that, maybe.
Yeah, I can jump into this one. So, like yourself, we have a system float pool, so you can kind of move into any of the hospitals in our system in a variety of roles. It was nursing first, and it's transitioned into some technical trades as well. So that's been, I think, helpful. We are definitely doubling down on, career planning and advancement within the organization and developing real succession plans so that people see the value and want to stay within the organization because they see they're going to be able to achieve their career trajectory. We've really spent a lot of time focused on employee engagement, and we've partnered with a technology that allows us to survey our staff pretty easily, develop and monitor improvement plans, and then follow through with the plans and to enhance engagement. Measure this stuff throughout the process, and incorporated that into our annual goals for our hospital executives and our health system leadership. So I think partnering with them has been great, so that we have a consistent partner to send the surveys out, retain them, have a portal to access the information and house it everywhere. It's a lot of work, but our goal is to, make ourselves the employer of choice. And without that investment, we're not going to get there.
100%. Joe.
Sure, I'll jump in next. When it comes to recruiting and bringing in staff during this time, it's very important to have a pathway laid out for them. We found that to be especially true for those who are on a nursing track. So being able to lay out from day one that if you stay with us, that we will help you with your education and provide the funding you need to go to your next level of your career. We moved from a model of having a reimbursed model to having a model wherein we pay up front for that education. So that's been very beneficial because it's so important to be able to, in day one, show our new staff that we have a path for you, that you can advance with us. And that's been very, very important. When it comes to the remote work, we also have a segment that's not coming back into our facilities. We know that is the case. What we do find that it's very important, however, to keep them engaged. And how do we keep a remote associate engaged is important to make sure they are. I tell our teams here often that if we have a department or a building if it's 1 foot off of our campus, they can feel disconnected. Imagine if they are at home every day, how they can feel disconnected. So it's important to make sure we are keeping them connected. And that comes to our leaders to make sure there is consistent contact and making sure they understand what's happening in our facility within our ministry to make sure there is a connection. Because with that, they're going to be highly engaged and ensure that moving forward, that they'll continue to help us provide great care to our patients. So it's important to keep that engagement regardless of the distance they are away from the facility.
I'm sure you're like me. We've all got a lot of plans for hospital week coming up, and a lot of that with remote as well. I believe we got everything from remote bingo, remote escape rooms to online to an actual in-person carnival, carnival, and giving away those the joyful rounds. It's something that brings me a lot of joy actually doing the rounding with the joy cards and bringing it to people as well. Lisa, how about your team? How are you finding it?
So I love the fact that Aaron talked about succession planning. Usually, when I started at this role about 3 years ago, the first 6 months, I already had a succession plan in place because I wanted to really understand who wanted to grow and what did they want to be when they grow up. So this way I can help them be engaged. And I'm very proud to say I've only lost one leader in 3 years, and that was due to family relocation. So we must be doing something right. The other big piece with retention, and we've been changing it to resilience. I've been fortunate that we've reduced our retention, our turnover rate from 22% in 2022 to 11% in 2023. And my facilities are all union. I have 6 different union environments. So my leadership has really been doing a lot around our magnet journey and engaging staff. And some of the tricks and tips that we've been doing, we instituted a 30, 60, 90-day interview process for all new hires that once they enter our doors, they don't want to leave. They want to be part of this team. I did negotiate a higher sign-on bonuses with our unions to get people here. But once you get them here, you've got to keep them. Money isn't everything. So, Aaron touched base on it, and so did Joe. It's really about the culture. So we're striving for an improvement in our culture of safety scores, our employee engagement scores, RN satisfaction scores. And, you have to keep consistently working on action plans because your generational theory dictates that things change. Your baby boomers want different things from their job retention than your Gen X's and your Gen Z's. So it's constantly reevaluating what works for this unit versus that unit because it is very different.
Yeah, 100%. One thing I brought in at 2 companies when I ran HR there was actually work to retire programs, because we had, obviously folks who were wanting to retire, but we needed to retain that knowledge. But at the same time, how do we train the new people coming in? So developed a separate class of benefits where they worked less hours a week, but kept their healthcare benefits at the full. And that's what they wanted. They wanted to be able to have that 4 or 5 day week and just do 2 days, but in return was able to use the reduced salary cost to bring in entry level and have them trained side by side to really get up ramped quicker. And looking at using something like that now in the healthcare, but I've done successfully at 2 tech companies. It's things like that. Is about trying to think outside the box. One of the things we're doing is working with Durham and the local community colleges to go in really early and start, like you said, people who identify that they may be interested in healthcare and start a shadowing program to bring them in so that they could see. And again, 100% with the rest of this panel on that engagement, listening, but also making sure they realize the action plans that you're putting into place. We have our teams working on what we call the pebble list, like that little pebble in the shoe. Like, what's the little things that we could do in each unit to really address, hey, that picture needs to be rehung, or, somebody keeps leaving, we need a new keyboard over here and nobody fixed it. So those little things that we could continue to work on. So we have a pebble list that we work with the team as well as using technology now to try and make it easier for them to work with HR. So they're not, who do I go to for what? It's one portal, go, we will go get you the answer. It should be as easy as it is in any other company to try and get that help, right? and we all expect, we've all been spoiled now by the internet, being able to go on and get what we need. So thanks, team. One of the things also, I think we were talking career pathing, you were talking, Joe, and the others play crucial roles in maintaining motivation and engagement. That's, obviously a theme we hear here. What successful measures have you established to facilitate motivation and engagement with your teams? How's this influenced your staff retention and resilience and satisfaction? Are there any key takeaways you've taken from your journey through pathing and improving your career engagement and your staff engagement? Lisa, you just were talking about it, so I'd love to hear more.
The culture that I'm in right now, and you have to look at your culture and what works. Again, being extremely rural, many of my staff are very entrenched in their communities. So one of the things we've done differently is really encourage staff to do community projects, whether it's teaching hand hygiene at the local school or children's museum, or doing a 5K run for fetal demise with mothers who have lost infants. It's really finding what is the connection between the staff on every department and the community, and how can we interlock those so staff know that the organization will support those initiatives, because it's a win-win for the health of our community. And we've been doing a lot of grant work in the state to obtain more funds, really focused in on what is our community needs assessment. And we've been very, very fortunate. I think the staff recognize that leadership is trying to improve the healthcare of the community, not just trying to fill our doors with patients.
That's great. Thank you very much. Really appreciate it. Aaron, going to pitch to you.
Yeah, we've developed a prescriptive plan around employee retention that, a lot of things everybody else is doing, 30, 60, 90-day check-ins, and, a really enhanced onboarding process, partnering the staff with a senior person, a more senior colleague that, can help navigate them through lots of cultural development, things that we're working on within the organization to improve our employment culture and, kind of foster a better environment for people to want to stick around. Those things have been pretty sticky. We've got most of those actions to build in, the day-to-day operations. So now we're probably a little more focused on things where we know we've driven improvement. So for instance, our nurse residency program here, the retention rate is twice that of the rest of the nursing hires. So if you come into our program, you're twice as likely to stay than you are if you are hired, a more senior person from outside the organization. So we really leveraged, leaned into that type of program and mentality, and so we're trying to use that model more broadly across the system. And then I think most importantly, we are most of our employees come from within 5 minutes of the hospital, so they're very, very local, even though we're in kind of a densely populated state. Our hospital is I would not call it rural, but it's not as densely populated as north, central, and northern New Jersey. And so we've had to change the way we identify, develop, and retain people in this market, and find unique ways. People still come in the hospital to interview nowadays, which is crazy. We have open houses, and pre-COVID, no one did that, but I think people are yearning to have more of a personal connection. So we have open house. That we had one just a few weeks ago, and it's right down the hall from my office. I walk out of the administrative suite, and there's 20 or so people in the hallway sitting, in a chair waiting to be pulled in to be interviewed and be offered a job on the spot. I think 25 or 30 people who ended up interviewing there, and 2/3 of them were offered a job on the spot with an offer letter, met their future supervisors, and spent 2 hours here and had a job. So I think we have to think a little differently, and those things, making that experience, the front end, better, I think will lead to better retention, because they'll come into the organization with less frustration than probably, how we've treated them in the past.
Yeah. 100%. I mean, it's a honeymoon period. We all know that first, 90 days. We've got to make it not as sticky, but feel that warm and welcoming, because they're always going to be thinking in the back of their head, did I make the right choice? Right. And because where they came from, they know people, they had friends, they had a routine. and tell people, you're not just hiring somebody for their skills, but it's bringing them in, as you said, that culture. One of the teams that I work with, the manager, I loved what he was doing. He told me when they're coming on, they ask them questions about who they like working with. Are they more introverted, extroverted? So even the preceptor that they're pairing them up with, they're being that thoughtful about putting them with somebody that from immediate that they'll get on with, as well as adding them immediately to the team channel that does all the memes, right? That's not with the leadership. So they make very personal, so that from the start, they're made to feel as part of the team. And it's something where this manager didn't even realize that other teams weren't doing it. And so making sure that he also got recognized for that across the other teams and those little things that can make a difference. Joe, what's your take on this? How is your team being doing it?
Yeah, kind of piggybacking on Aaron there, said he comes out of his office and meets those applicants. And that's our focus here, is that as an admin team, we get out of the office and we get in front of our frontline associates. I mean, there we have a significant focus on rounding. It's something that's been tried and true. Rounding is nothing new. However, in terms of how you do it and how well you do it is a significant focus for us here. So as an admin team, we are out and about. We're making sure that we are in front of our associates and getting feedback that's actionable. And that is the key, is making sure that we listen, we receive the feedback, and we take action on it. We have a system set up that on every Tuesday during our regular weekly admin meeting, we collate all of the comments that we've received over the previous week. And then we assign ownership to who is going to take this comment or this suggestion to a resolution. And then we can close the loop with our associates. And we go around on associates, on physicians, as well as on our patients. So each of my admin team members, we have a goal of how many we're going to round on. We bring that back and we hold each other accountable to make sure that we close that loop. And so, as we know, rounding is more than how is your day going. Rounding is what's working well for you today. And these are, tenets that we've heard before. Do you have the tools to do your job? If you don't, what are those things that you need? And then it's incumbent on us to find a way to provide it, or if we're not able to provide it, to close the loop and give an answer as to why. And this has been very significant for us because our associates, they understand and see that we need to hear from them and that we are driven by what their needs are. And that closing the loop component is the piece that really brings it all together. My goal is to always not hear the comment, we've brought this up many, many times and nothing has happened. I'm sure we've heard that amongst our careers, and I want to make sure we don't hear that moving forward. And so this is a way also that our associates can hold me accountable and my team accountable for making this happen. We have shared our process with our leaders, with our associates, to understand what we do on a weekly basis, and we want to make sure we do it well.
Thank you so much. I really appreciate diving into there. I'm writing notes as well, because we're all swapping ideas, being like, oh, that's a good one. Well, let me take that for the future. Took it in. One of the retention or resilience, I love that, Lisa, perspective. What best practices or programs have you established to promote mental health and that resilience? I know at the start of the pandemic, I could see I worked at a different company. It was a construction, design, electrical engineering, and saw just how difficult it was for that population to come out and say that they weren't doing okay. And that we could see it was a tsunami of mental health issues. So we actually instigated, as well as that stretch in the morning for getting ready for the workday, and doing their stretches physically. We actually checked in with them and started doing a check-in mentally, how everybody was doing, and saw a reduction in issues with the staff, as well as utilization went up of mental health services that we brought in, as well as brought in mental health break days too, when it was really tough every quarter. So I'd love to hear from the group, what kind of things that you're doing right now? What are you seeing? How are you helping? Let's jump. Joe, you were just there. So Lisa, I'm going to jump back to you.
So it's a balancing act. We've done a lot of work and spent a lot of money on adding AI to help with work efficiencies, giving the nurses mobile devices to communicate, to document, to help with deterioration. But at the same time, we've created wellness teams and tranquility rooms, including virtual reality, massage chairs. We have QRS codes for yoga meditation. So if during the day you can't get to the tranquility room, you can pull up a QRS code and get some guided imagery to help you relax. We've done a lot of work on both ends using as much artificial intelligence and technology that we can to really offer some variations so our nurses and everybody in our organization has the ability to do better, do more for our patients, but at the same time, take care of themselves, because that's critical. That's the only way we're going to keep our recruitment going and our retention high.
That's fantastic. We brought in a Better Together team, but a Care for You team. And the team can be referred by managers, but also by the employees. That's specifically just for them. And it's an in-house program. It's not an employee assistance program. We have that as well as outside, but this is inside the program that can actually directly talk to them. Especially also, we've scheduled now breaks after traumas, because we do recognize that obviously all the staff are impacted in different ways. In the last couple of years have been stopped. So I think it's great that we're finally putting it on the top of the list of things to address, not as an afterthought. So that is wonderful. Joe, how about your teams?
I love the tranquility, Lisa. We have a similar concept, and in terms of what to name it has been a question as of late. So we might steal that from you. So yeah. I love that name. But also in terms of from a mental health standpoint, one thing that we really do focus on as much as we can, number one, is to create a sense of where there's a psychological safety, where our associates can feel free and are free to be able to express that they do have some needs. And we are blessed here within the ministry, Bon Secours, to have directors of mission at our facilities. And these roles are tremendous when it comes to being there for our associates. They are called in at times to have a conversation, having a rough day, to help them get through those times. They do confide within that role of that person. And that's very, very beneficial to us. I think that is something that may set some of our facilities apart, because having this role is so integral to who we are as a ministry. And also, we do have, of course, different QR codes to different websites that people can log on to and to share how they feel and to get some of that off of their chest. Our question is, how often is it truly used? And we're finding that utilization is underutilized. So that's why we always focus on the person they're going to most likely go to is going to be the fellow coworker, associates that's beside them. And that's why I really try to foster those communications, those interactions, because that's who they're going to go to, and to make sure they feel open and able to do that from a psychological safety standpoint. It's a tough time. I cannot deny that. COVID has really impacted us, and however, at this time, I cannot understate the ability to have that best friend at work is going to give more benefit than some of the other things we have in place for a mental health standpoint.
Yeah, 100%. I tell managers, people don't leave managers; they leave psychological trust broken. Right? That's why a good manager is, and it's a testament of it. One thing we did find also was just obviously in the last year with rising costs was a struggle for folks to say, hey, I just waiting to get my next paycheck. And especially when you have large hospitals or large centers and you have the range from housekeeping, EVS, all the way, to transport. And so we did bring in earned wage access so that we could break that cycle of going to those pay loan places. And it was great for us in that they can see also on their app every day, it sends them an email how much they've earned to date. And they can transfer that money as easy as going to the next day or immediately for the monthly and the hourly staff. And I came in, and one of the things that I did a little differently was I put all the signs for it in the bathroom, on the back of the bathroom doors, because trapped reading. I was like, to get the word out, because we found otherwise a lot of the folks don't necessarily have emails. The staff that would need it, that are really walking around with a laptop that often. So just thinking a little differently how you communicate out. It was another thing we found with getting out the words of different programs. Because as you said, if you have a program and it's not being utilized, then it's really not helping you or helping the employees. Aaron, how about yourself? How's your journey with the hospital and the services with mental health and resilience?
So first of all, it's interesting that we're talking about this. 10 years ago, 20 years ago, this would never have been a discussion, right? So I think partially because of COVID, partially because of the younger workforce and what their needs and how they think and act are different. We have to kind of really dig into this. And I'll go back to, I think Joe said about the chaplaincy program. We really leaned into our chaplaincy program, and in a number of instances, really leverage that in some situations where we really needed some advocacy for our staff and have somebody for them to speak to, and across the system, that's really been a huge asset for us. We really have focused on trauma debriefing after an event, which is it's an interesting situation like that. Those things didn't exist 20 years ago when I got into healthcare. Like, you would never sit around and talk in a group about your feelings after a traumatic event, but it's been a critical tool for us. And we really, unfortunately, had to deploy that. Deploying it once is too many, but deploying it a few times over the last year or so because of, critical incidents, I think, has been helpful, but still frustrating that we need that. I think locally, we've really looked at, how do we invest in our, and thank our staff. And we created I Made a Difference campaign a couple times a year, a few times a year. I think we're doing it every quarter now. Anybody who was mentioned in any patient survey, by name, gets invited to a luncheon, and we, give out awards and big thank yous and make a big deal of it. It's really nice. What we just had one a couple weeks ago, and whole units, came to support the 2 or 3 people from their unit who got recognized. It was really great to see. We've also really looked at, the tools in our disposal. We have something called Recognize You, which is a workforce app where you can, give people kudos and recognize them on this app. And we utilize that a lot so that, people are aware of, that we see the great work that they're doing. And the last thing, which it's sad it exists, but I'm really proud of the fact that we have it, is we have a employee support program that's run through our foundation that our employees donate to every year across the system, and we put dollars into an account to support employees who are struggling through challenging times. Maybe they are getting divorced and they don't have money to pay the light bills or electricity or whatever for the month, or their car broke down, they don't have the means to fix it. It gives them some financial resources that they can use to support their acute needs. It's anonymous. It gives them up to a certain amount that they can access to support their needs, their immediate needs, and then also a pathway of how can we help them and support them to get out of whatever hole that they're in, and what can we do as an organization to be their partner through this. So it's been a really great program. I'm very proud every year when I get to donate to it, and we have incredible participation across the organization, with people putting in money from their own pocket to support this program. It's really something that I think we don't market enough to our staff to let them know, A, that it's there, but B, how much that we're doing to support them in the little things.
Yeah, So, little tip in the bathroom. No, that's
Yeah, I'll take that.
really-
That's a great
Yeah.
idea. I actually took a note of that. I really like that.
It's well, and genuinely, it's we have to constantly keep reselling our own benefits to our staff, right? We tell the new hires, we tell the recruiting, know it, but people are in there and they don't know, especially if you've been there for a little while, may not see. Just have to keep reselling to your staff of why it's such a great place to work, and I love that support. It's really something I've seen. Wasn't in the tech organizations that I was with. I saw it once at another company, like I said, the construction, and coming here, same thing. We have a donation group that does that, caring for you, from the employees, and also a PTO program. So that people can donate their PTO to a program for folks to take time who have used up all theirs. Either they're not eligible or they've gone past the time they had available. So making that community support as a cornerstone of it. So it's thank you. And it's great to hear that a lot of the great places I know that are going to work are doing a lot of the same things. Talking about, the standardization, right? And making things easier and making things working smarter. What measures are we taking to optimize workflows, reducing the waste, embracing technology to aid existing staff, from training, task automation, education? What are you doing to take away those boulders that basically stop them getting their jobs done day to day? Or it just seems like, if you remember when email came in, we said, oh, we'll never need any more copiers. Paper. That did not happen.
But we still have fax machines, right? Even after all that, we still can't get rid of fax machines. Yeah.
Or we said, oh, we'll have meetings, we won't need emails. And it seems like when we went to, everybody went to virtual during COVID, we actually ended up with more meetings and more work on top of our plate. So let's share what have we done to try and get out of their way and bring technology to standardize. Lisa, jumping to you again.
Well, it's interesting. Aaron was talking about some of the engagement celebrations. Just today, we had a rock star celebration. We recognized 333 employees this quarter. And instead of doing paper forms where somebody nominates somebody that's a rock star or employee of the month, everything's QRS now. Daisy Award for nursing, we now have QRS codes all over. And I like the idea too. I think I'm going to put QRS codes all over our bathroom because that's the way people want to respond. They don't want to do paper. They don't want to have to log into a system that's clunky. Even our virtual education and more simulation, we're looking to see what more can we do. And even on our screensaver, we now have QRS codes about ideas about how to improve our care in the community. So I think we're looking at things very different than we did pre-COVID. So I'm thankful for COVID. And I keep saying there are positives from COVID because we're learning to do things better. And when you use the QRS codes, it's very tangible because you get real information in real time. Mm-hmm. You're not waiting for somebody to correlate, 3,000 pieces of paper. So hopefully we'll find more and more uses of technology to make it easier for staff to participate in every type of function that they have.
I think that's great. I mean, I also see it not only from the engagement and culture side, but also even for their day-to-day questions, making that day-to-day management tasks easier, making onboarding easier. It's saying, well, is there one email that they can send to or one portal they can go to where they can get all their answers? Please don't make them hunt, right? We may have to make it easier to get away those frictions because it is those little paper cuts that can really wear down your staff and us included, right? Making it easier. Joe, how about yourself?
There you go. Yeah, one thing that I would say we're doing currently is the use of the mobile devices to bring so much to a mobile device. We have Epic as our EMR, and we currently have Care Mobility as the system that brings to the devices texting through Perfect Serve for different things happen with patients, but also documentation through the telephone, seeing your vitals through the telephone, or through the mobile device and receiving calls through that same mobile device. So that's one way we're bringing technology into the hands of our associates, and it's helpful. However, there's a learning curve that we have along with that as well. Thinking so with anything that's new, there's some resistance in the beginning, then it gets better over time. But it's amazing what the technology can do. Again, there's basically a computer that's in your hand that you're able to do all of your work on and document all of it in a safe and a HIPAA compliant way in your hand. And that's been very beneficial to us. We've had these on hand probably about 8 months or so. So it's still somewhat of a learning curve. It's getting better. I think, but however, it's going to be what we're going to use for the vast majority of our documentation and patient care here as we move forward. Not only here, but across the spectrum, as we very well know. But that technology is so improved from the days of, as we know, of doing handwritten notes, and now even people were coming out of school, they've never even written a handwritten note. So this is something that is intuitive to many of our associates at this point in time. And as we continue with the technology going forward, the more it can do, the better. And of course, it's getting smaller. So I can only imagine what technology is going to be in place in the next, say, 10 to 15 years compared to where it is now.
Oh, yeah, fantastic. 100%. I was showing the staff the other day, just using Common AI on a Copilot on Teams, and how let it run the transcript, and not only did the transcript and do a summary, but it put it out in topics and then put out action steps at the end of it, right? And so that's great for staff who are not attending, and say, hey, here we go, and by the way, we volunteered you for X, Y, and Z because you weren't at the meeting, but here's your steps and here's the background of it. And it really will do a lot of that lift of that day-to-day stuff that, can really, what would you do with that extra 20 minutes? Instead of sitting there and going, oh, let me have somebody summarize it because X wasn't at the meeting and we need to go off and do it and do next steps, or identify what emails I maybe didn't get to today that are priority and flagging them. So those things for the managers too, showing them as well. Another thing we've done is and again, my background being in tech, we've developed personas, because change management, Joe, as you were pointing out, is very difficult for different groups. So doing different personas for all of the different types of employees that we have, from those who are digital natives, I just came out, I was born with the iPhone in my hand. That's what my parents used to, when I was, to entertain me, always been on it, to the older folks who were like, or people who don't necessarily have access to mobile during their job during the day. And using them as understanding the different personas and seeing what their journey would be like for any project that we have coming through. So we can definitely embrace the change management journey a lot easier, because we know we've got a lot of great ideas, we can roll out things, but unless we see them through and stop, measure, change and adjust as needed, sometimes it can be like we're always bringing out a new program and not getting the embraced of it. So 100%, thank you for that. Aaron, how about your team? How are you finding that journey, and what have you been using to help standardize and embrace technology?
Yeah, our system started our Epic journey about 1.5 years ago, I guess. So, a lot of things that Joe just mentioned, like we're kind of there too, just like really adopting lots of handheld device usage and giving people more flexibility of when and where and how they document. Which is, I think, for the younger generation, something that they really appreciate. Going to the very simple thing of single sign-on. We have dozens of applications, and shifting to a single sign-on has been incredibly easy and helpful in navigating everything we're doing from day-to-day basis. With Epic, we've moved to a neat handoff, to try to get patients on the floor easier, kind of remove the logjam of a nurse calling a nurse to give, limited and maybe misinformation or outdated information, and putting it using, leveraging Epic to be able to give a really concise report to the nurse on the inpatient unit. And then finally, you had a colleague who mentioned the other day that, they were developing a business plan, and they just, use Chat GPT to come up with the bones of the plan so that it's, saved them an hour of typing nonsense and gave them time to really, do the analysis to input into a written plan that, would document, what our goal is for the next couple of years and keep, so that we had something to refer back to. And so it's still important to have that information, but if you can, use, leverage ChatGPT and the other, models out there, it sounds simple, but it really, is can be a huge asset and save a lot of time, and it lets you kind of refocus on things that are more important. So there's lots of AI tools out there, particularly around, like right size staffing or just in time staffing support. And, we have a AI center of excellence that we're building in our academic center that will help us do that, leveraging Epic and some other tools. The problem right now is all of these companies out there developing standalone independent platforms. And so we really need to work on being pragmatic and developing a kind of integrated approach to utilizing those technologies so that we're buying something and getting the value out of it instead of buying it and then realizing 2 years later, it just didn't work the way we needed it to because we didn't prepare ourselves to use it. So that's kind of what's next on our radar.
Yeah, shelfware is what we used to call it in the tech one. It basically sits on the shelf and you don't use it again.
Yep.
Great. Last question for the team, and thank you so much for all of the time that you've taken out your day to contribute some really wisdom. I've been writing down of these like great things that we could implement in our hospital too. What creative or unique incentives have you introduced to recognize the dedication and hard work of your clinical staff and non-clinical? Would you share a success story from your organization that led to a noticeable reduction in staff burnout and improvement in patient care? I know on our side, just even this week, prior companies, we had managers originally, or it was one set of staff that would, wrap up stuff to give to people for a week. Now we've moved to technology platform to do it, so people could actually pick from a selection of different gifts. It feels more personalized. They can also then ship it to their own house. So the managers are like, you just saved me 5 hours, right, on their unit. But making sure that they also get the thank you to give it to them and get that time to sit down with the staff, which has really helped us, and staff saying, hey, thank you, I really appreciate it. It was such a small thing. But I'd love to hear from the team what your teams are doing and nuggets that we can share with the group.
So we've got a couple of creative ideas. We do have another QRS code that people can actually go into an innovation lab and offer different ideas and suggestions, especially of ways that they want to be recognized. Within a union environment, it's always difficult to do some direct dealing with individuals, so you got to be a little careful that you're fair and equitable. We've done a lot of work around encouraging people to go back for certifications and offering incentives around that. More on the professional lines. But, some of the things that we've done that are kind of simple is, free meals on the holidays. I have to tell you, my staff love the kitchen's green beans. I get more compliments about green beans than if I was to give everybody a box of candy to say thank you. So you have to know your culture and what they appreciate. And that free meal sometimes it means a lot to people because there are some people that are struggling. So we definitely look for staff to come up with ideas as well, what works for them. So our unit-based councils try to come up with innovative ways, whether it's, potluck Friday, whether it's, free coffee, free donuts, anything that we can think of that might seem simple, but it goes a long way.
100%. Joe.
Absolutely. So we do have a recognition program as well for our associates. Is the Call to Shine platform. So I think it has a lot of utilization on that platform, but I do want to point out a couple of special things that we do use it for. Across our entire ministry, you're able to nominate your associates for a cultural leadership award, or someone who is really living the mission of our organization, and we can recommend them on a quarterly basis. And there are, across the ministry, there are usually, quarterly 10 or 12 maybe across the ministry that are celebrated. And that is something that's really unique to the platform because, again, you have someone for your facility that's recognized across the entire ministry, all of our facilities. So we can then recognize them internally as well for doing that. And having the ability to do that on a quarterly basis is huge. We of course recognize people as much as we can throughout their different months and weeks and all of that. However, being able to be recognized on a organizational basis is huge for our teams, and we're glad we have that ability through that platform.
Fantastic. Aaron.
Yeah, I mean, we're doing the same things, I'm hearing here, except for the green beans. I don't think anybody's beating down our door for the green beans. So we had to check Lisa to see if those are, locally grown, locally sourced green beans from upstate New York that we need to check in on. But, doing the same stuff. I think that what I've done, and I think we're starting to build a culture here in our leadership team to do the same thing, is handwritten letters, going back to the old school. Like, I don't remember the last time I hand wrote a letter that wasn't to my mom. Or my dad, or actually my mom and dad. That's probably the only two people I've written a handwritten letter to. And so really lean into that and writing, when somebody really does something amazing to recognize that. And even though they probably can't read anything I write because I write like a doctor, but just making that personal connection. It's the technology's been great because it makes it very easy to recognize people, and which is great. But I think my experience has been, if you take it a step further and make it really truly personable, you can't do it for everybody. You can't do it, 20 times a day, but you can do it, once a day or once every couple of days. So that's really what I've really been focusing on. So the people who are out there watching this, if you got a letter from me and you can't read it, I apologize, but it did come from my heart with whatever it said. So
100%. One of the places that I worked, I brought in Valentine hearts, and just with Sharpie, and I sat down and I wrote something nice about everybody. And it took me several hours staying over very late to put on a glass wall, and then left it out for other people to do it. And people came in and started writing it and sticking it up. And after it stayed up for a month, and folks still come up to me 10 years later and say, Sinead, I still have my hearts. Because they came and said, could I take them? And I was like, oh, absolutely. I don't care what role you're in. Everybody likes to hear a thank you or something that, somebody said something nice about them. So really appreciate all of the sharing. This has been absolutely fantastic. And we're going to be doing a virtual Q&A for today's panel. So please submit questions to connexx@connexxpartners.com. And we'll all chime in on the Connexx community. We're looking forward to hearing what you came up with, or if you implemented any of these ideas, or if you have ideas of your own that you'd love to share, we would love to hear it. So questions, answers, suggestions. Again, thank you so much, Joe, Lisa, Aaron, and Connexx Partners for bringing us together. This has been a fantastic opportunity to learn from other people in the health field, and I hope you feel the same way too. Thank you.